very institution charged with protecting and defending our country has not always protected and defended its own members. I apologize on behalf of the Government of Canada and on behalf of those elected officials who, throughout the history of the Canadian Armed Forces, had the responsibility to protect you and who failed to do so.
I am sorry. We sincerely apologize for the trauma that you have experienced. To those who suffered in silence, we are sorry. To those who shouted until you could shout no more, at great personal risk, only to have no one listen to you, we are sorry. To those who came forward and were told to be quiet, to not rock the boat, to think of your career, or to prioritize the career of the person who harmed you, we are sorry.
The federal government, National Defense Department, and Canadian Armed Forces delivered a formal apology today to victims of military sexual misconduct. The apology was first promised in 2019 as part of a $600 million settlement with current and former service members in several class action lawsuits.
The apology was made virtually because of the pandemic. It comes as the Liberal government and military leadership struggle with several allegations of sexual misconduct involving senior officers. Joining us live tonight to discuss is Tina J. Park, Vice President of the NATO Association of Canada and a lecturer in Canadian nationalism at the University of Toronto, and Emmy Sam Semplonius, co-chairperson of It's Not Just 700, a volunteer-run, non-funded organization that offers help to those impacted by military sexual misconduct and military sexual trauma in the Canadian Armed Forces. And Sam, you are a survivor yourself. How do you feel about this apology issued today?
It was very emotional. We expected it to be. We have been warning the members of our group to ensure they had a self-care plan. You really didn't know how you were going to react until you actually heard the word. Some people were not going to listen today. They didn't want to hear it today. They weren't in the right place where they wanted to hear it. Some people are just too angry to really listen to an apology right now still. And some people they did need to hear something for a sense of closure. They've gotten to a place in their journey where they've decided they want to put things behind them, and they could possibly use this apology as a benchmark to say, okay, now it's time for me to move on and start living my life for me.
Sam, what else could that look like? I know, again, this is a start. We heard these apologies today. What else, I guess, would you hope to see from here?
Well, within our group, we have been engaging with the senior leaders within the Canadian Armed Forces and the Department of National Defense. And one of the things as part of the class action was to get a formal peer support program in place, because we knew as a grassroots movement ourselves that we, don't have the clinical expertise and certifications to be able to help some of the members in our group, because some of them really do need a type of therapy that we just obviously can't offer because we're just other survivors ourselves on the same journey. So all we can do is offer advice as to how we've coped with things. So it was very important to us in the class action suit that money be put aside for a formal peer support program that was funded and available to all survivors of sexual military misconduct, whether it be people that were retired or serving or veterans. We're hoping it gets expanded eventually to also include families.
Mm-hmm. Because there's a mountain of allegations, right, Tina? I mean, we have been hearing from survivors like Sam for years, people coming forward with their personal stories, and now a class action, and then we get to today. How would you describe, in the history of this, the significance of this apology, Tina?
I mean, I think this apology is certainly an important first step towards real reconciliation and closure for some of the victims, but it is not enough. We know that there are hundreds of other members who may still need to come forward, and really this process will be a very lengthy one in terms of changing institutional culture and investing in early education and training and ensuring that everybody feels that they are safe at workplace and that they feel that they are able to come forward for such a difficult kind of experience that they've had.
So, Tina, the federal defense minister says change is already underway to address issues in the country's military. What should that change really look like now?
I mean, I think there are many recommendations that we should pay close attention to, also from Justice Arbor's report and recommendations that she has put forward. But first of all, we need to understand that the senior leadership in the military is in need of diversification and in need of a generational change. And I think that we need to invest more in attracting the best talent to the Canadian Armed Forces and ensuring that there is a greater sort of diversity in terms of not just our identity, but also in thought. So we know that unless we get to the really core problem of the issue, which is really, how the Canadian Armed Forces has been operating for many decades, we really will not be able to make meaningful progress on this issue. And I think the Minister Anand and other members of Canadian Armed Forces are well aware of the kind of critical steps that must be undertaken so that we can move forward with more than an apology.
So, Sam, how would you describe how Canada has handled these cases so far?
I think they're doing the best they can do with the policies that are in place. We know that there's policies that do need to be changed. We know that obviously there's attitudes that definitely need to be changed. And I think that's going to be the hardest part, is changing the attitudes. Policies are, they're policies. You can change them with a stroke of a pen and a few committee meetings, but it's the attitudes that we're really concerned about seeing changed. And that's going to take some work, because you can't order somebody to be a nice person. You can't order somebody to be respectful of other people. I think what we need to do is we need to show our people that are joining and our people that are in is that we want to be the best military that we can be. And in order to do that, we have to be all on the same team, and we all have to be respectful of each other and our differences, and include those, and not spend or waste our time being disrespectful of just because somebody's different or because they have a different idea. It is a leadership, definitely a focus that needs to be on the leadership. And for some of the things that we are engaged in as a group, we are hearing stuff that's happening within the Canadian Defence Academy. They're talking about leadership training stuff that's going to be coming forward. Our biggest hopefulness part is the Sexual Military Response Center. They're coming up with more ways of being able to support survivors that are either out or are still in the system. So these are things that, for us, our focus is on the survivors. We need to take care of them, and we recognize that we also want to prevent further harm from happening to other people. So that's where the attitudes and changes in the type of leadership that's been going on for years has to happen.
And we're learning with systemic change, it's top down and it's also on the ground, right, Sam? With all of this coming out and this apology today, I mean, should these allegations be tried in a criminal court? Why should the military be investigating allegations against the military?
I think it depends on what the degree of the allegations are. The problem with calling it all sexual misconduct is that runs the whole range between an inappropriate comment to somebody being grabbed inappropriately to somebody actually being raped. And we need to look at the fact that while the harm in some cases may be just as great to somebody who was groped or touched in an inappropriate way, the harm of somebody being raped is, first of all, falls under the Criminal Code of Canada. So it would totally make sense that shouldn't be something that gets tried within a military court. But when we're talking about things like inappropriate comments or something that was done strictly because the person was just not really thinking, those aren't the kind of things that we want to tie up the courts with. Because I've had my last case went through a criminal court, and it took 2 years to bring it to trial. And that was 2 years that essentially destroyed my marriage, because we couldn't survive the stress. We couldn't survive just the impact it was having on our family of not knowing what was going on. And I was victim of sanctuary trauma and that I didn't feel supported. So hearing some of those things within the apology today from the CDS, things like we're going to have your back and we need to support our people better and we need to respond better. Those are things that give me hope and really, I just really hope that no one else has to go through the same stuff that I went through. And because really it was more than me that was hurt. It was my ex-husband and my children and my friends that know what I went through. So that's really why we're trying to prevent these things from happening.
Sam, I'm so sorry for everything you've had to go through over the years. Sam Samplonius, Tina J. Park, thank you both so much for joining us tonight.
Thank you.
Thank you. A couple who flew into Pearson from South Africa on Sunday have been staying in a quarantine hotel, waiting for a COVID-19 test to clear them from their room and allow them to continue isolating in the comfort of their own home. But it's taken 2 days of phone calls and emails to their MP, Carolyn Bennett, for them to finally get a test just a few hours ago. To share their experience, we're now joined live by Lucille and Mickey Narn, who join us live from their quarantine hotel room. Hello to you both. How are you?
Hello. Hey, good, thanks.
How has it been? You recently got tested. Lucille, can you tell us about that?
Yeah, we were delighted at, I guess, about 4 o'clock this afternoon when 3 people showed up at our doorstep, all dressed up in their plastic outfits and masks, and did the test at the door. So that it was the actual test was extremely efficient. It just took a long time to get it.
Yeah, how did that come to be? Why did it take so long, Mickey? What was it like when you landed on Sunday?
Well, we landed on Sunday expecting to be tested there and then at the airport. Unfortunately, it's taken until now, or a couple of hours ago, to be tested. Now we're tested, so it's done.
Yeah. There was a lineup at the airport with people waiting for tests, but because we had been in South Africa and had a little dot on our passport, we were ushered through and told that the test would be done at the hotel. So we thought that's great. And when we arrived at the hotel, no, there was no test. We were just checked into the hotel and were told the test would be the following morning. Well, after many calls and nagging the front desk and Switch Health and Public Health Canada, we finally got on the list and they came to our doorstep.
Okay, so you had to be proactive about it to get that PCR test, and now you're waiting for those results.
You never know for sure whether you had to be proactive or whether it was just something that's the way they do it. You delayed and delayed and delayed, and should have been that same day. It's now the end of the second day that actually happened.
And how are you doing, Mickey? How are you holding up during that wait?
Fine, just normal jet lag. You've just got 7 hours change of time, so rightfully we're supposed to be tired.
Yeah, absolutely. Yeah, and it's not just the two of you, right? Lucille, you've met other people along the way. They're in that quarantine hotel as well. Do you know if everyone from South Africa has been able to get tested?
Well, there's an active WhatsApp chat group of people who are in various hotels. There's 3 or 4 of them. Keep in touch with what they're up to. People have been waiting the same thing to be tested. People, some have, some haven't. People are now very anxiously, many people have been waiting a long time to get their test results. And then once you get a negative result, doesn't mean you can leave the hotel immediately. You have to get a public health officer to approve you to leave, and that can take 1, 2, 3, 4 days. So there have been people who've been here for many days. And as you can imagine, I mean, we're a couple, we have company. There are people that are on their own. There are people with young children. And it's been very desperate for many people.
Mm-hmm. Mickey, what do you make of these travel restrictions on specific African nations?
Well, I think it's ridiculous. This, whatever you call it, cron came about obviously at least 2 weeks before it was reported, and it didn't even start in South Africa. It actually started, I believe, in Holland, but it just happened to be well detected by fantastic doctors and researchers in South Africa, and now they're being punished for it.
Yeah. And so when you boarded your flight back, you knew about having a quarantine. Did it unfold the way you expected, Mickey?
Not at all. We were hoping that we were going to be tested when we arrived here very reasonably and quickly, which obviously 2 days is what it seems to be what is happening to all of us. And I don't think that's right. Why couldn't it be done at the airport?
Mm-hmm. Lucille, what are your thoughts?
Well, we believe, and through this chat group, people are arriving in Vancouver and leaving the airport after an hour and a half and able to go and quarantine at home. They were tested at the airport and out they go. And we were all told to put together a quarantine plan, depending on your circumstances and where you're able to quarantine. We have a home that we're on Lake Simcoe that we're able to go to and quarantine quite happily. We have people putting food in there and access to services, but nobody in Ontario, it seems, is allowed to quarantine at home until they get this approval from the public health to leave the hotel. So it's inconsistent across the country as well as across the various hotels. Some people, there was one woman who was on our plane, in fact, who was tested the morning after we arrived, got her results this morning, and in fact left the hotel she was at this evening. So the processes are very cumbersome, inefficiently handled, and not the same for everybody.
Carry on.
No, please, Mickey.
No, well, it's also there's such a small number of us. We're only about 20 people got off our plane. Why couldn't we have been handled quicker?
Well, and I wonder how much this is costing both of you as well. Have they told you what the bottom line will be?
No, this is free. The government is paying for our stay here.
Which, well, we are as taxpayers.
We and my friends as the co-taxpayers, they're the ones who are complaining. We at least get the benefit of this, I must say, a lovely room and a lovely hotel. Food hasn't been that bad. And it's comfortable, but who wants to be here? We want to be with our family. We want to see our family. We want to be able to speak to them more freely. Granted, they can't come and live with us at the moment, but at least we can talk to them a lot freer.
Yeah.
And we can, and we have some ability to walk outside. We haven't been outside at all in 2 days. I know some people in hotels have had 30 minutes or so to be able to go outside, especially people with children. So it's a little confining. We haven't been able to do any walking, any exercise.
Yeah, I hear you on these restrictions, and I appreciate both of you making time to share your experience with us. It's nice to see you both sitting so closely, even though you've been stuck together for so long. That's a good sign. And you got that PCR test today, so hopefully you get those results and you're back on Lake Simcoe as soon as possible. Lucille and Mickey, we wish you the best. Thank you.
Thank you so
very much.
Bye-bye.
Take care. Bye-bye.
In response to the growing Omicron variant, the Ontario government is changing who is eligible for a third dose of a vaccine against COVID-19. Starting Monday, all Ontarians 18 and up who received a second dose at least 3 months ago will qualify for a booster.
The Premier also announcing a new campaign handing out free rapid tests at transit hubs, markets, and LCBO stores across the province. For reaction to this, we welcome to CP24 Tonight our medical experts, Dr. Peter Uni, the head of the Ontario Science Advisory Table, and Dr. Andrew Buzari, Chair of Social Medicine at the University Health Network. Thanks to both of you. Dr. Uni, I'll start with you. The big question here tonight is really how much more protected are we against the Omicron variant with this third booster dose?
Oh, it will help quite a bit. What we know right now, based on very preliminary data from the UK, is that the protection will be about 75%. This is against roughly 90% when you start after 2 doses against Delta, and 94, 95 against Alpha previously. So it will be good. Right now, with just 2 doses, we don't have much protection left. If we're more than 3 months down the line, perhaps 20%. That's very little.
Dr. Broussari, I know that many health officials have been calling on the government to lay out a plan. Was today's announcement, does it go far enough?
Yeah, I mean, I'd agree with Dr. Uni. I think it's very encouraging about, I think there's been a lot of calls and advocacy to ensure that we're seeing earlier eligibility for the booster dose. I think, again, the news around the rapid antigen testing, that's really encouraging, and it's just going to be really crucial for the weeks and months ahead. And I think there's been, again, calls regarding capacity limits, and I think there's still some room there. But I think, again, seeing that the government is acting and the fact that we know that we're going to have, the next leg of the race of our lives ahead over the next 2 to 3 weeks, is something to look into for this December.
So I understand the science is constantly changing. Dr. Uni, can you explain to us and our viewers why the guidance on the interval between our second dose and third dose now has changed from 6 months to 3 months?
Oh, the virus has changed, so we need to change the guidance if we see that it doesn't work anymore the way we thought it would. Before it worked beautifully, now it doesn't anymore. So it needs to change, and I'm very glad to see that they reacted very quickly. But there's a caveat here just about what Andrew said before. We need to be aware of that. This is really important what we're doing now with the vaccine rollout and with the rapid test. It won't be enough to change the trajectory of the wave. We need to do more, very clearly.
But Dr. Broussari, with the Omicron variant spreading much quicker than what we saw with Delta, this is painting a really dire situation. Can you put things into perspective for us?
Yeah, I think that the comments made by Dr. Uni and the science table today in terms of the data that's released about just how transmissible Omicron is something that I think is startling for all of us. But I think when we think about just knowing that with a higher reproductive number, and that we've seen that we've not had an equal response and equal protection throughout the pandemic, when you have Omicron as a variant that's able to seize upon the cracks and fissures in our society, people who are not able to isolate or physically distance, who are living in shelters. We know the risks for people living and our elders living in long-term care, and we know the risks for healthcare workers and essential workers. So I think it's a dire stretch. I think that urgency was relayed today. And I think just the challenge and the concerns is that if we're going to open up the gates for vaccines and for rapid antigen tests, we need to ensure that those who are at highest risk are really able to access these life-saving measures.
Right, so let's talk more about those tests. Dr. Uni, do you think these tests are best used in the places that the Premier says they will be? For example, markets, LCBOs, and transit hubs. What about schools? We didn't see that.
Yeah, so first of all, we're about to end the school year before Christmas, or the school term. So it will be for a moment less of an issue. We don't have, millions and millions as we would like to. There are more to come, and we need just to use them wisely. We need to flood the market, really just the population with rapid tests. And then we have certain situations where they're really very important, such as long-term care, hospitals, etc. And the point really is people need to remember, if you have had 2 doses of the vaccine, more than 3 months down the line, forget it. You're basically at risk than an unvaccinated to get infected. Only your risk to have severe disease is less, meaning you also need to do rapid testing.
Wow. And either gentleman, you can answer this question. I know we've been using the word booster, but many are saying that really should technically be switched to a third shot. And explain the importance of why this third shot will make a difference here.
May I start, Andrew?
Of course.
So look, the point here is that with Omicron, it's clear 2 doses will not afford the protection we need at a population level to also slow down this highly transmissible virus. That's the challenge. So with Omicron, this has become a 3-dose vaccine. If we say a booster, we make it optional. 3-dose means you need to have complete protection.
Yeah, and I would just agree with Dr. Uni. I think the messaging on this is so essential. I mean, I think all of us wanted this to be a 2-dose vaccine. I mean, I think that's the other element in terms of all of us who've been involved with vaccine campaigns, who've been working in the healthcare system. we're really hopeful that 2 doses would be enough. But I think as Dr. Uni has mentioned and has really laid out so starkly, is that 2 doses is no longer enough from what we're seeing with the data and the evidence that's coming in. And I think that shift into thinking about it as no longer a booster, but this is a 3-dose vaccine is something that we need to start to see permeate out there for people to understand that really fully vaccinated or being as best protected as possible is going to mean having 3 doses.
Dr. Uni, I want to pick up on something that you just said, that if you don't get that booster right now, if it's been 3 months or more since your second dose, which a lot of us are in that boat right now, that you're basically unvaccinated against Omicron. That's a huge statement to make, and I think that's news to a lot of folks who are watching right now. Tell us how that impacts your guidance for how people should spend the holidays this year.
So first of all, it's important. This is as if you were unvaccinated if it comes to infection. You still have a lot of protection by all we know against hospital admission and ICU admission and death. It's important to distinguish the two. But if you think about our friends, family, etc., this just means that you need to be very selective with whom you meet, and you need to behave the way you behaved before you were fully vaccinated with 2 doses. I shouldn't say fully anymore, fully now with 3 anyway.
Right.
So that's the point. We need to just change our attitudes again.
And in terms of eligibility, it's now been increased, obviously now opening it up to 18 and older, but in what sort of, how many doses are needed in terms of the population being vaccinated with that 3rd dose to really make a difference?
We probably need about 50% of the eligible really just with the 3rd dose. That's a lot of people, 6 million people. So, you know, you can do the maths yourself. Hopefully we will be able to vaccinate 200,000 people per day, but this will take some time. And during this time, we really need to have quite a lot of public health measures to blunt the wave a little bit. It will be too demanding otherwise.
Dr. Bazari, you were calling for some changes to capacity limits to big indoor venues yesterday on Twitter. We did see that happen today, but no changes to the number of people who can gather indoors when it comes to household gatherings. Would you like to see something like that?
No, I mean, I think that, you know, Janelle, where the challenge is just think that it's this policy disconnect. You know, I think in terms of where we need to go into the holidays, as Dr. Uni has mentioned, in having very clear messaging, a new frame, new sort of understandings about how to best take care of ourselves and each other and our vaccine status and things that can be done around testing and all these new tools that we have that we didn't really have a year ago. But I think when you look at, you know, people having given up so much, they've sacrificed a lot, wanting to be together or be around loved ones for the holidays, and then to know that you can still sort of have 10,000 people in an arena gather to watch their favorite sports team. And full disclosure, I'm a huge sports fan. It's hard to see that gaining traction with the public given these new sort of limitations and guidelines. So we'd really love to see more alignment on the policies to make people feel better and safer about seeing each other, about ensuring that they're keeping their holidays safe. And I think more messaging and more guidance about this, instead of just saying, you know, be careful. I think we need to see that be more granular and be more aligned for people to be able to make the best decisions they can this holiday season.
Last year for the Christmas season, there was a full lockdown here in Ontario, and now we're seeing more restrictions now. People obviously getting frustrated and worn out because we've now had Delta variant and now Omicron. And so what's your message to people who are just incredibly frustrated by restriction after restriction after restriction?
Oh, I'm completely frustrated by this virus that is basically upping its game all the time. And I'm completely exhausted too. We don't have a choice. We need to deal with it. This wave is here. It's coming. It will be a tidal wave, and we need to deal with it now. Meaning, be creative. Make your life as safe and as rich as possible. This doesn't mean that you have to have, hundreds of people that you need to see. Do that small, elegant, use the new tools, and just make sure that you understand this too shall pass. If we actually if we aren't careful, it will go very quickly and the wave will be over in 6 to 8 weeks in any case. But then we have a lot of calamities and we don't want this to happen. So we need to do the right thing now, and that's not a lockdown. But what it is being smart about all the capacity limits, etc. You can still do shopping safely, etc. You can still do many things, but not at the capacities we have. Right now, we have zoos in restaurants. We can't afford zoos in restaurants anymore, neither in bars nor clubs.
Dr. Uni, before we let you go, I just want to ask you very quickly about some discussion today about whether or not this strain of COVID-19, the Omicron strain, is airborne. What's your take on that?
Well, all SARS-CoV-2 was airborne. From the beginning, we learned that the hard way last summer at the latest. That's when I completely changed my thinking. It's beyond any doubt that this one, as everything else, is airborne here. This doesn't mean it's the same story as measles or so, but we need just to be aware of that. If you have a plexiglass screen in front of you and there's air circulating, the air will go to the other person on the other side of the plexiglass. It's as simple as that. We need good ventilation, good masks that are well fitted, etc. And that's part of the game. We need to be aware of that.
Okay, Dr. Peter Uni, Dr. Andrew Bozzari, thanks to both of you for joining us tonight.
Thanks so much.
The Canadian Blood Services is now asking Health Canada to remove a ban that did not allow gay and bisexual men, as well as some other members of the LGBTQ2S+, to donate blood. Instead, Canadian Blood Services would ask all donors, regardless of their sexual orientation, if they've engaged in higher risk sexual activities. The move is one that the organization says would allow more equity for donors while ensuring a safe blood supply. Joining us live to talk about the possible change in the organization's policy is the executive director of the Alliance for South Asian AIDS Prevention, Pranay Anand, along with the OHTN Endgame Chair in Gay and Bisexual Men's Health, David Brennan. Both of you, thanks for joining us tonight. First to you, David, this is a policy that's had a long and controversial history with the Canadian Blood Services. What do you think this application that the organization has submitted means for the LGBTQ2S+ community?
Well, I think it's fantastic news, Mark. Thank you. I have long been an advocate for ensuring that the blood donation policy reflects science and not bias. And this application is really about making sure that when we're looking at safety of the blood supply, which is, of course, very critical, that we're doing it from an evidence-based perspective. And there's lots of evidence now gathered by numerous researchers around the globe, but also particularly here in Canada, funded actually through the Canadian Blood Services, that is beginning to show that there's really no potential risk of HIV, an increase in risk of HIV being put into the blood supply through this change in policy. As you probably know, they've made a couple of changes in the policy over the last few years, and that has not in any way increase any potential risk. So this is the next best step. It's not about identifying a group of people like gay men. It's about identifying particular behaviors and what it means in relationship to HIV risk.
And Pranay, I know the change would still allow the organization to ask donors if they've engaged in, quote, higher risk sexual activities. Do you think this move goes far enough in representing the people impacted?
I think it does, because as we've talked about so many times, it was specifically targeting gay men and just saying, okay, because you are a man and you're having sex with men, you're automatically banned from donating blood, right? So, and then we went through these incremental steps towards making policy changes. And finally, it's not about identity as so-and-so, that it doesn't disallow an entire group of people to become ineligible to donate blood. And it is more about behavior. It's more about the risks that people might be, certain other criteria just based not on your identity and not who you are. And so I think that is what's most important about it.
And David, should the move have happened sooner in terms of a timeline here?
It's hard for me to say. I wish it had happened sooner, quite frankly. The evidence behind all this could have been gathered sooner and could have been done sooner. But it's happening when it's happening. I appreciate that there are people at CBS who are really trying to ensure that this is an evidence-based policy. That is not to say that the long-standing policy hasn't had a tremendous negative stigma on gay men. in particular, also on trans people. This is not even to mention kind of a whole history of the way that racialized people, particularly Black and Indigenous people, have been excluded in the history of Canada from donating blood. But like any institution, Canadian Blood Services has had to kind of, look closely at their own policies, and they'll need to do some work here on relationship repair with the gay community. There are lots of gay men who are at absolutely zero risk of HIV transmission who've not been able to give blood over the years, myself included. Just because I have a partner or a husband, does that mean I can't give blood? That doesn't make any sense, right? Especially if the blood is already being tested. So there are lots of ways in which the policies have been are really perceived as very discriminatory over the years. And so this is, I think, a move to kind of strike down at that kind of built-in systemic homophobia that occurs in the context of blood donation.
And Pranay, I know this is something that has a long controversial history, but take us back to why this was put in place in the first place.
The fear and anxiety of not knowing, it takes us back to the AIDS crisis back in the 80s, right? Like, we don't know what's going on in the community. These groups of people, their blood is tainted. They engage in high-risk activities, and as a result, let's ban this entire group of people. And so, rightly, David, you mentioned about homophobia and transphobia, and just like being so afraid of the unknown that it was highly discriminatory to pick a group of people and say, no, not you. Just because you're part of that community, just because you identify as gay or you're a man who has sex with men, no, not you, not your blood. And that's just, in my opinion, cherry picking and just highly discriminatory is what I think it is. Yeah.
David, to you, what would removing the ban mean for removing the stigma surrounding gay men and HIV?
Well, I think it's hard to know exactly, because I think, quite frankly, the stigma of homophobia runs deeper than I think a lot of Canada wants to admit. I think this is one step, but as I mentioned earlier, I think there's work on the part of CBS. If you think about things like what institutions like police departments or other kinds of academic institutions, government institutions have had to do to repair a relationship of, really kind of castigating and discriminatory behavior, as Pranay has mentioned, against a particular group. That work still has to be done. I can tell you, each time there has been a change in this policy, I have made the drastic mistake of looking online at comments that people write about this news. And you would be shocked. I think most people would be shocked at the kind of homophobia that gets stated as people think about the possibility of having gay blood in their body. It reminds me of Archie Bunker from All in the Family back in the 70s, when he got blood donation from a Black woman and was just kind of freaked out. There's still that kind of fear and stigma. I am hoping, and I know that there are good people at CBS, there are great people at CBS, quite frankly, who really want to figure out how to engage in that relationship with the queer communities across Canada, and there's work to be done. And it's their work, it's not our work, and we're looking forward to helping them think about how to do that.
We'll have to leave it there and see what happens next. Pranay Anand, David Brennan, thank you both so much for your input tonight.
Thanks for having me.
Thank you. Thanks for having us.